Hello, I'm Dr. Derek Carroll with Back to Health Chiropractic, and I'm going to talk to you a little bit today about something that seems to bother quite a few of the people in our world today. It's a pretty hot topic, and that is carpal tunnel. So oftentimes people will complain about pain and tingling in their hand, weakness, that kind of stuff. And there's a lot of different things that are grouped together into what tends to get referred to as carpal tunnel. So I want to go ahead and clear the air about some of the things in regards to carpal tunnel, and really what we're looking at with carpal tunnel is numbness and tingling in the hand, but specifically these three fingers. Okay. If we end up on this side, we're not talking about carpal tunnel. Now, what carpal tunnel really is when we have entrapment of one of the nerves that goes through the hand as it comes right through this area here. That's called the carpal tunnel. Now what happens is we've got a little band of tissue that goes across the base of the wrist that as the wrist itself starts to flatten out because of overuse issues, repetitive things, constant typing on a keyboard, that kind of stuff, that wrist will start to flatten out. And as that happens, we start to pinch one of the nerves that runs through the wrist here. So you've got a fibrous band of tissue that runs across here that's called the retinaculum, and as that flattens out, it will press that in and will start to block nerve flow there. Now, one of the most common reasons this happens is because of one of the bones in the wrist. This little guy right here is called the lunate bone. It happens to start falling forward down into that carpal tunnel, and that's what puts the pressure on that nerve. So from a medical perspective, what tends to happen is they go in and they'll go ahead and cut that flexor retinaculum. And what happens then is it releases that, takes the pressure off the nerve, and you end up with no symptoms. The problem is that we need that flexor retinaculum to keep the arch of the wrist. When we cut that, it starts to do this, and over time you're going to end up with the same problem that you had to start with, and you end up having to have repetitive surgeries. What we do from a chiropractic perspective, and tends to be very successful for the vast majority of people, not everybody, but the vast majority of people, is we go ahead and take that wrist and we start bringing that arch back. Okay, between some exercises that we do, plus adjusting the wrist and bringing that bone back up out of the carpal tunnel. It's usually a very gentle adjustment that usually doesn't hurt at all. I can't say that it doesn't hurt every time, but occasionally it does, just based upon inflammation and how much overuse issue there is there. But at any rate, the vast majority of carpal tunnel cases, we are able to rehab and improve without sending you down the road to the surgeon, so you don't have to end up with multiple surgeries resulting in ongoing issues there. So if you've ever had this type of an issue, or if you know anybody that does and might want to try and avoid surgery, you can feel free to give us a call here at Back to Health Chiropractic. Our number is 970-635-2848. Thank you very much, and I hope you have a wonderful day.